It happens in a split second, a misstep on a carb or a sudden twist during exercise. We commonly call this spraining an ankle. But in that brief moment, the ligaments inside your ankle endure a massive impact, either tearing or stretching beyond their limits. How you respond in these early stages determines the health of your ankle for a lifetime. Today, we will take a deep dive into price therapy, the gold standard of emergency care that you must practice immediately after an ankle injury.
Before we get into the specifics of treatment, let's look at other forms of chronic foot pain. Plantar fasciitis, characterized by sharp pain during your very first step in the morning, is caused by micro tears in the fascia. This can improve significantly with consistent stretching. On the other hand, hallux valgus, where the big toe shifts out of alignment, is a structural deformity that may require surgical correction in some cases. However, an acute ankle sprain is a different story. Even with a third-degree sprain, where the ligament is completely torn, you can achieve over an 80% recovery rate without surgery if you manage the initial treatment correctly. The key is what we are about to explain: price therapy.
The first 48 to 72 hours after an injury are the golden hours. Failing to control swelling and inflammation during this window can lead to chronic instability. Remember these 5 steps. First, P for protection. Your top priority is preventing further damage. Immediately after the injury, avoid putting any weight on the foot. Use crutches or secure the ankle with a splint or brace. Remember, even small movements can cause a damaged ligament to tear even further. Second, R for rest. This means more than just taking it easy. It means a total cessation of activity for the injured area. If you start walking just because the pain has subsided, the ligaments may heal loosely, leading to a chronic, unstable ankle. You must give your body the time it needs to heal itself. Third, I for ice. This is one of the most critical steps. Cold packs constrict blood vessels to prevent internal bleeding, reduce swelling, and numb the pain. Apply for 15 to 20 minutes at a time, 3 to 4 times a day. To prevent frostbite, always wrap the pack in a thin towel before applying it to the skin. Fourth, C for compression. Use an elastic bandage to apply appropriate pressure to the injured area. This physically prevents fluid from leaking into the tissues and causing excessive swelling. However, if the wrap is too tight and causes numbness or tingling in your toes, adjust the pressure immediately. Fifth, E for elevation. This involves positioning your ankle higher than your heart. By using gravity, it helps blood and fluid drain away from the injured site and back toward the heart. Simply propping your foot up on 2 or 3 pillows while lying down can remarkably speed up your recovery. Once the acute pain and swelling are under control through price therapy, it's time to prevent a recurrence. You need to strengthen the peroneal muscles to support the weakened ligaments. Practice pushing your foot outward against a resistance band. Additionally, incorporate proprioception training by practicing balance on one foot. This trains your brain to react instantly the moment your ankle starts to tilt, triggering the muscles to block a potential injury. There are no shortcuts when it comes to ankle injuries. More important than fancy surgeries or expensive treatments is the fundamental principle of practicing price therapy the moment you get hurt. Never ignore the signals of pain your ankle sends you. Proper emergency care and consistent rehabilitation are the only ways to get your feet back to a healthy state. We hope today's lesson on price therapy serves as a reliable insurance policy for your precious feet.